Hello everyone. Now we are going to discuss about clinico-pathological correlation in cell injury, in which we have discussed certain examples of causes of cell injury or mechanism of cell injury. First is hypoxia or ischemia. In arterial obstruction or reduced venous drainage, there will be decrease in blood flow, and which ultimately result into the decreased oxygen supply, which is known as hypoxia. Ischemia is stand for decreased blood supply, and this result into the cell injury. Whenever there is hypoxia, this will induce factor 1 secretion, which result into the neovascularization. Neovascularization means development of new blood vessels, which works as a collateral blood vessel and try to replenish the blood supply. Whenever there is decrease in blood supply, this will result into the decreased oxygen delivery, which inhibit the aerobic metabolism, and on the other hand, decreased blood supply result into the decreased delivery and clearing of the substrates, which result into the inhibition of anaerobic energy generation. So decreased blood supply will result into the decreased aerobic metabolism as well as anaerobic energy generation. So what is the mechanism behind the injury in hypoxia and cell injury? Hypoxia and ischemia, whenever decreased blood supply is there, this will result into the decreased oxidative phosphorylation and ultimately result into the decreased ATP production. ATP is essential for the functioning of the sodium pump, which normally transport sodium outside the cell and potassium inside the cell. Whenever this sodium pump function improperly, this will result into the influx of sodium along with the water and calcium inside the cell and efflux of the potassium, and this will result into the cell swelling and cell injury. Another mechanism due to decreased ATP synthesis is increased anaerobic glycolysis, which causes low glycogen, decrease in glycogen concentration, and increase lactic acid concentration. Increased lactic acid will result into the low pH or acidic pH, which will cause or culminate into the clumping of nuclear chromatin. The third mechanism of decreased ATP synthesis is, or result of decreased ATP synthesis is, detachment of ribosomes from the endoplasmic reticulum, and this will result into the decreased protein synthesis. Now we will see another clinico-pathological correlation or mechanism of injury is ischemia reperfusion injury. So what are the mechanism behind injury through ischemia reperfusion injury? The first is oxidative stress. Whenever there is restoration of oxygenation, this will result into the increased production of free radicals due to incomplete reduction of oxygen in leukocytes. These free radicals damage the endothelium and parenchymal cells. So oxidative stress is the one mechanism in ischemia reperfusion injury. The second mechanism is intracellular calcium overload. Whenever there is acute ischemia, this will result into the intracellular and mitochondrial calcium increase. In reperfusion, reactive oxygen species induce membrane damage to the sarcoplasmic reticulum. This will also result into the increased intracellular and mitochondrial calcium, and this ultimately culminate into the decreased mitochondrial ATP synthesis. Third mechanism of tissue injury in ischemia reperfusion injury is inflammation. Whenever there is ischemia, this will result into the increased danger signals from the dead cells and macrophages. They recruit the neutrophils and result into the tissue damage. The fourth mechanism is activation of complement system. Ischemia result into the deposition of IgM antibody by some unknown mechanism or unknown reason, and this will stimulate the or activate the complement system. Now we will see the chemical or toxic injury to the cell. This could be a either direct or indirect injury. Indirect chemical injury, some of the examples are: mercury directly attack the sulfhydryl group of the cell membrane protein and result into the increased membrane permeability and cell damage. Cyanide attack the cytochrome oxidase and result into the decreased ATP production. Other examples are anti-cancer drugs and antibiotics. In indirect chemical injury, first the chemical convert into a toxic metabolite, and that toxic metabolite will result into the cell injury. Cytochrome P450, which is present on the smooth endoplasmic reticulum, convert these native chemical into the reactive toxic metabolite, and they either free radical or directly bind covalently with the cell membrane proteins and lipid. For example, CCl4 by the action of cytochrome P450 convert into the CCl3 free radical and result into the cell injury. Paracetamol and its toxic metabolites will result into the cell injury. So in clinico pathological correlation of cell injury, we have discussed three mechanisms or three events. First is hypoxia and ischemia and how it affects or result into the cell injury. Second is ischemia reperfusion injury and various mechanism of ischemia reperfusion injury. And third is chemical or toxic injury. Thank you.